healthresourcedirectory.org.au. Patient Fact Sheet. Understanding the dying process. What happens when a person is dying? It is very difficult to predict exactly what will happen. Some people deteriorate rapidly, slip into unconsciousness, and die within hours. Some people are awake and alert right to the time of death. Others may be in and out of consciousness over a period of days. Some things that may happen and what you can do. The dying person usually becomes drowsy and spends more time sleeping. At times, they may become difficult to wake. This is due to major organs slowing down and getting ready to stop. The best time to communicate is when the person seems alert. Never assume your loved one can't hear, so continue talking to them. There is less need for food and drink. This is a natural and inevitable part of the dying process. Almost everyone will completely stop eating and drinking. Do not offer food or fluid to a person if they are unable to swallow, as this may cause them distress. To keep the mouth moist, use swabs dipped in water or fruit juice. Your nurse will provide these, or apply Vaseline to their lips. The dying person may become confused about time, where they are, and the identity of family and friends. Talk calmly and confidently to reassure the person. Identify yourself by name. Use a nightlight and keep familiar objects in the room. The dying person may become restless or agitated. There are a number of possible reasons for this, including discomfort, fear, or the need to resolve unfinished business. Contact your nurse or doctor for further advice. Try to find out what is concerning the dying person and offer comfort and reassurance. Try a change of position, mouth care, or toileting. The person's arms and legs may feel cool. Their lips, fingers, and toes may look blue. This is due to blood circulation slowing down. Avoid too many blankets, as this can cause overheating and restlessness. Loss of bowel or bladder control may occur when a person is very close to death. Use incontinence pads and sheets to protect the bed and maintain comfort. A catheter to drain urine may be required. Saliva and mucus may increase in the back of the throat as the person becomes too weak to cough or swallow. Sit the person up a little or turn them to one side. Mouth care may help. Talk to your GP or nurse, as medication may also be of assistance. Breathing patterns may become irregular with times of no breathing at all. This is a normal part of the dying process as the respiratory system slows down. This is usually a late sign. Contact family members who wish to be present at the time of death. How will I know when the person has died? There may be signs that death has occurred. These include possible loss of control of bowel and/or bladder. Stiffness of muscles occurs several hours after death. Relaxation of facial muscles with mouth and eyes slightly open. The person is unresponsive and not breathing. No visible pulse or heartbeat. What should I do after they have died? There is no hurry to do anything immediately. You may wish to spend time with the person who died. This can be a time of sharing and closeness for family and friends. It is helpful to note the time of death and let your nurse know. If it is during the night, this can be left until the morning. For a death at home, you need to inform your GP. If it is during the night, it is all right to leave this until the morning. Your GP will need to complete some forms. These are forms needed if the person wanted to be cremated, so let your GP know. Contact a funeral director to help make the necessary arrangements. You might like to choose a favourite outfit for the person to be dressed in. There may be a lot of people to tell that the person has died. This can be tiring and stressful. Think about asking family or friends to help you make these calls. Caring for someone who is dying. The reality of caring for someone 24 hours per day may be impossible to sustain at home. There may be an unplanned admission to hospital, hospice, or long-term care facility. If you are a caregiver, it is important not to feel you have failed or let the dying person down if this happens. You can still provide valuable support and care even if they are not at home. There is no right way or place to die. You and your family will go through it in your own way when the time comes. Time at the end of life can be precious. Make the most of the time to share your special moments, express your feelings, say goodbye, and perhaps discuss unresolved issues. Children need open and honest information from adults when someone they love is dying. It is important they feel included in discussions and in caring for the person. Encourage them to talk about their feelings and ask questions. What supports are available? For people wishing to die at home, the PEACH, Palliative Extended and Care Home program, is available for the person's last 7 days of life. Speak to your GP about how to be referred to this service. There are a number of grief support services in southwestern Sydney. The Southwestern Sydney Local Health District Bereavement Counselling Service is based in Prairie Wood. You can make an appointment by calling 9616 8678. Other grief support services include Southern Highlands Bereavement Care Service. Phone them 4862 1701. Leukemia Foundation Grief Support. Phone them 9902 2222. Transcultural Mental Health Team. Phone them 9840 3800. Bereavement Care Centre 9869 3330. Solace. Phone them 9519 2820. Quest for Life Foundation Retreats. Phone them 1300 941 488. National Association for Loss and Grief. Phone them 8230 1527. Canteen. Phone them 1800 226 833. Lifeline. Phone them 13 11 14. The Compassionate Friends New South Wales. Phone them 9290 2355. This information is to be viewed by someone who has received a diagnosis from their doctor. It is not designed to be used to diagnose a condition or as a substitute for ongoing medical care. Health Resource Directory fact sheets are endorsed by Southwestern Sydney PHN's Community Advisory Committee and local GPs.